I hope cartilage we have done. Ligaments, guys.
Yes, ma'am.
Three types of ligaments. Perfect. Okay. Capsule, bursa,
Yes,
types of joint. What is their range of motion? What is an arthrodial joint? Amphiarthrodial joint is done? Yeah. Perfect. So, okay,
ma'am.
guys. Yeah. Okay.
Ma'am, I little bit confusion between capsular and extracapsular ligaments.
Okay. So extracapsular means outside the joint, Harshita. Anything outside the joint is considered as extra-articular or extracapsular. Capsular ligament means which is nothing but it's not a ligament which is made up of fibrous tissue. It's a capsule which is thick and act as a ligament. It's not a fibrous tissue as ligament. It is a thick capsule which serves as a ligament is called as capsular ligament.
But ma'am, we have wrote right now the capsular ligament is the classification of ligament. So
Yes,
I have a confusion that कि extracapsular is located outside the मतलब outside the joint or capsule.
exactly.
So
Yeah, please go on, go on.
yes, ma'am.
Yeah, please ask. Please go on.
I'm asking that we have wrote that extracapsular ligament is located outside the capsule. But
Yes,
capsular ligament is also located outside the joint.
exactly.
Differentiate between capsular and extracapsular ligament.
So, ligament is a tough fibrous connective tissue. Am I right?
Yes,
What
ma'am.
is capsule made up of? Guys, what is capsule made up of?
White fibrous connective
It is a
tissue.
white fibrous connective
White
tissue which is
fibrous connective.
primarily made up of collagen. Right, that is what capsule is. When it comes to ligament, ligament is a short fibrous connective tissue. Both are fibrous connective tissue only. Okay, in
Yes.
ligament it has not having much collagen, but in the when it comes to capsule, it is primarily made up of collagen. Okay, so ligament is something which is outside the joint will be like this. Commonly, outside or inside, it could be anywhere. Capsular ligaments means it is a white fibrous tissue, okay, which is thick and act as a ligament. That is called as capsular ligament. For example, if you take this is capsule. Okay, this is a joint capsule. If you look at over here, these are capsular ligaments. These are capsular ligaments. Just a thick layer of the capsule is considered as the capsular ligaments, which also act like as a normal ligament where it will restrict the range of motion. Okay? Yes, thank you.
Yes, ma'am. Thank you.
Thank you. Okay, guys. Now we are going to discuss about muscle. So, as we already have an idea, muscle is the only structure where it comes to creating the range of motion. Right? If any other structure in a human body have no effect, only have a muscle can able to do. Okay? Muscle have various structures along with it. Do anyone have any idea what are the different structures of a muscle is? Any idea? What are the different structure a muscle have?
Actin, myosin,
Act that are proteins. Okay. Anything
protein.
else?
Ma'am, skeletal, cardiac muscle structure.
Okay. So I'm asking about layers, structure of muscle. What are the structure of muscle? What is the structure of the muscle?
Sarcolemma, sarcoplasm, uh, then reticulum, sarcoplasmic. अच्छा.
Very good. Anything else? Sarcolemma, sarcoplasm, epimysium, perimysium,
हाँ,
endomysium.
endomysium.
Right. So these all when it comes to the structures of muscle, right? Isn't it? So let me just share you something. 1 minute, guys. My screen is sharing. I hope for everyone's screen is visible. So it comes to structure of muscle, we have something called as epimysium, guys. So epimysium is nothing but the overall covering of the muscle. Overall outer covering of the muscle is what we call it as epimysium. What is mean by fascicle? Fascicle is nothing but inside a muscle, we have lot of muscle fibers, guys. Inside a muscle, we have lot of muscle fibers. In that muscle fiber, there will be some group and group arranged as a bundle. For example, 1,000 muscle fibers, 100 will be arranged as a bundle. That bundle is called as fascicle. That bundle is called as fascicle. Epimysium, which is nothing but outer covering of the muscle. Inside the muscle, we have n number of muscle fibers, which will be arranged like a bundle. That bundle is called as fascicle. Okay? That fascicle covering is called as perimysium. Epimysium is the muscle covering. That bundle covering is called as perimysium. Okay? Inside the bundle, we have 100 muscle fibers now. In between one muscle fiber to the other muscle fiber, there will be a layer that is called as endomysium. Let me explain it one more time. The muscle covering is called as epimysium. Inside the muscle, we have 100 muscle fibers. Okay? That will be arranged as a bundle. That bundle covering is called as perimysium. Okay? If we take a bundle, it will have n number of muscle fibers. In between one fiber to the other fiber, we have a layer that is called as endomysium. Epi outer, peri bundle covering, endomysium muscle fiber covering. Like it's go deeper and deeper. Okay? So these are the different layers when it comes to the muscle fiber. Let me just share my screen once again. So in between the muscle fiber, we have the fascicle and we have sarcolemma, which is nothing but the layer underneath the endomysium. Then only we have myofibril, sarcoplasm, actin, myosin and sarcomere and everything. Okay, so this is called as the structure of muscle. I want you guys, so basically like this case. Can you see? Will be a muscle. The muscle covering is called as epimysium. If we take a muscle, we will have fascicle, that 100 number of muscle fibers. That covering is called as perimysium. If we take a muscle fiber, that covering is called as endomysium. Inside that only we have actin, myosin and everything. I want everyone to quickly write this down. Quicker. Only 2 minutes. Come on, please be quick. Are we done, guys?
Ma'am.
Everyone done? Can I move on? Yes, right, guys? Anyone is writing? No, right? Okay, perfect. So this is called as the structure of muscle, guys. So now we are going to discuss about the next thing. Okay? How a muscle actually work. How a muscle which actually will activate. So whenever a muscle needs to be activated, then the signal should be coming from something called as neurotransmitter. From the brain only, the signal should come. So that neurotransmitter, which is nothing but acetylcholine. Am I right? Okay, let me just share my screen so that you guys can understand this with the image. So there will be acetylcholine coming from the muscle, coming from the brain to the muscle. So what exactly it will do? It will do as something where it can able to make the muscle to go for contraction. How it can able to make the muscle to go for contraction? Where it will go inside the muscle and activate the actin myosin filament theory. How many of you are aware about this? Actin myosin filament theory, sliding filament theory and all? Any idea what it could be? Yes or no, guys? Any
Yes,
idea?
Yes,
ma'am.
ma'am.
Okay, well, perfect. So then it would be easier for me to explain as well. Let me just share my screen. I hope my screen is visible for everyone. Okay. So if you see over here, guys, this is the neuromuscular junction, guys. From the nerve, the acetylcholine will be released into the muscle. Inside the muscle, it will go to all the layers and reach to the deepermost layer, which is the sarcoplasmic reticulum layer, guys. As you can see over here. So when it goes to the sarcoplasmic reticulum layer, from our food, from the diet, and from everything, usually calcium will be stored in our sarcoplasmic reticulum. Okay, how bone is storing the calcium? The same way muscle will also be stored that calcium. So when the sarcoplasmic reticulum comes in, the muscle will get triggered and the calcium will be moved from sarcoplasmic layer to the sarcomere layer. Let me explain one more time. Whenever we are working, the brain will will send the signals to the muscle. The signals will be carried as acetylcholine. Whenever the acetylcholine entering into the muscle, it will make the calcium to move from sarcoplasmic reticulum to the sarcomere layer. Okay, in sarcomere, it will go and bind in the actin. As you guys can see over here, can you see? So the calcium is binding on the actin, guys. If you see, this is actin on the both sides, and the center will be the myosin. Okay, so whenever it is coming and attaching on the actin will get contracted to each other, which is what we call it as shortening of the muscle. Okay, which is what we call it as shortening of the muscle. The actin and actin getting contracted to each other is what we call it as shortening of the muscle. So whenever the muscle work has been done, whenever the muscle is worked, okay, so if you see the relaxation needs to happen, very simple procedure, the acetylcholine will be removed automatically. As we can see over here, the acetylcholine will be removed. Then the calcium will go from towards, can you see? The calcium will get back to its original position. If it's go to the original position, the actin will come back to its normal stage. This is basically called as sliding filament theory. So this is basically called as sliding filament theory. And this is how usually a muscle will work, guys. It is depend upon the acetylcholine, it depend upon the actin myosin filament. This is how usually the muscle contraction will happen. Okay, to explain this only, I have to explain about the structure of the muscle. Coming back. So, muscle is the only structure in our human body which has excitable nature, where if it get an impulse, it will go for contraction and relaxation. So, it is the only contractile tissue, one of the contractile tissue in our human body which can react to a stimulus. When it comes to ligament and anything else will not a contractile tissue, those are non-contractile tissues. So muscle is the only contractile tissue. How this contraction is happening, that's what we read in today's class, where it can able to go and bind on the actin. When it is compressed, like attaching to the actin, it can able to create the actin myosin sliding filament theory. Okay, so we call it as motor unit recruitment. We can call it as sliding filament theory and all sort of it. So now we understood what is muscle, what are the structure of muscle, and what is the muscle architecture. Right? Everyone clear with that? Yeah? Perfect. Now we are moving on to the next thing, guys. So we are going to discuss about now something called as muscle architecture. So this is what we discussed, guys. Let me just share the screen so you will be. Yeah. Can you see? So the covering of the muscle is called as epimysium. If we take a fascicle, that covering is called as perimysium. If we see a muscle fiber covering, that is called as endomysium. Okay? And if we take one muscle fiber, it will have sarcolemma, sarcoplasm, myofibril. In that only we can able to see the actin and myosin, which is the A band, I band, the sarcomere and all type of things. Now, we are moving on to the next thing, which is called as muscle fiber arrangement, guys. Okay, muscle fiber arrangement. So when it comes to the muscle fiber arrangement, we have two categories, guys. One is called as parallel muscle fiber arrangement. Another one is called as pinnate muscular fiber arrangement. So what does mean by parallel? Parallel is nothing but very simple, where the muscle fibers are in parallel to each other. Can you see the image? How it is like parallel to each other? That is called as parallel muscle fiber. Then what is called as pinnate? So pinnate is nothing but this is a tendon, guys. Okay. So the muscle fibers run diagonally towards the tendon. Not parallelly. If it goes diagonally towards the tendon, that is basically called as the pinnate muscle fibers, guys. So we have parallel and pinnate. Okay. So parallel have various types, guys. So it has 5 different types. The first one is called as fusiform, strap, circular, flat, all convergent. So there are basically 5 types of muscle fibers, guys. So what are they? One by one we will see. First one, let us go for something called as, see, flat, fusiform, strap, radiate or convergent and circular. So usually 5. So the first one, flat muscle fiber. So what does mean by flat muscle fiber? A muscle fiber which will arises from aponeurosis, guys. If any muscle fiber arising from aponeurosis is a white tissue, guys. Any muscle fiber arising from aponeurosis which is flat, broad in nature. Okay? If it is flat and broad in nature, that is called as flat muscle fiber. Let me explain it one more time. In parallel, we have 5 subclassification. The very first subclassification is the flat. Flat is nothing but the muscle will arise from aponeurosis. As you can see, the muscle will be usually thin and broad, originate from the aponeurosis. If any muscle is thin and broad, originating from the aponeurosis, that is called as flat muscle fiber. That is called as flat muscle fiber. The second one, we have fusiform. What is mean by fusiform? Fusiform is nothing but where the muscle will be ending with tendons on both the ends. For example, look at over here, guys. Can you see the biceps over here? Where it will have tendons on origin as well as insertion. Right? If anything have tendons on origin and the insertion, that is called as fusiform muscle fiber. The third one which we have is the convergent muscle fiber. So what does mean by convergent? Convergent is a combination of flat plus fusiform. So what is the combination of flat and fusiform means? It will be originate like a flat muscle from aponeurosis, guys. It will originate like a flat muscle from aponeurosis and it will insert as a tendon like fusiform. It will originate like a strap, like what is called as aponeurosis, and it will end as an insertion as a tendon that is called as convergent muscle fiber. Okay? And the fourth one which we have is the strap. The fourth one is the strap. So what does mean by strap muscle? Strap muscle is nothing but from origin towards the insertion, there is no belly, no tendon. From the origin towards the insertion, the muscle in the same diameter. If the diameter of the muscle is same throughout from origin to insertion, that is called as strap muscle fiber. Okay? That is called as strap muscle fiber. The next one which we have is the circular. Circular is nothing but, can you see? Origin and insertion will be close to nature and it will be in the circular in shape. That is called as circular muscle fiber. So guys, totally we have 5 category. Flat, fusiform, convergent, circular, strap. Flat means the muscle will arise from an aponeurosis. Fusiform means origin and insertion will have tendons. Convergent means it's a combination of both. Origin like an aponeurosis, insert like a tendon. Strap, from origin towards the insertion, the tendon will be in the same width. Fifth one, circular. Origin and insertion are close to each other where it will be like a circular muscle. Okay, so this is the 5 category when it comes to the parallel muscle fiber. The next one which we have is the pennate muscle fiber. So pennate is nothing but, as I mentioned, it will be diagonal in nature. Okay, diagonal in nature. It has 3 variations: unipennate, bipennate, multipennate. Let me just show you. Wait a minute. As you can see over here in this image, very straightforward, guys. Unipennate means, can you see? The muscle fibers are one direction. Bipennate means 2 direction. Multipennate means multiple direction. Okay. So if any muscle, where the muscle fibers are running in a diagonal nature, that is called as penniform muscle. It has of 3 variation. Unipennate means one direction. Bipennate means 2 direction. Multipennate means multiple direction. Okay. So this is the muscle, basically the fiber arrangement. How we had a bone tissue arrangement. What are the 2 types of bone tissue, guys? What are the 2 types of bone tissue?
Cancellous.
Cortical bone and
Cancellous.
Very good, Urvi. Very good, Anjana. So cortical bone and cancellous bone, right? So the same way when it comes to muscle also, we have parallel and pennate. Okay. So we discussed about, apart from the muscle structure, muscle function, that is basically the sliding filament theory, physiology. Then we discussed about the fiber types. Now we are, tissue type. Now we are going to discuss about the muscle fiber type. When it comes to muscle fiber, there are 2 types, guys. Type 1, type 2. Slow twitch, fast twitch. Slow twitch fiber and fast twitch fiber. So let me just show you 1 minute. Right. So when it comes to muscle fiber, there are 2 types of fibers, guys. One is slow twitch fiber, another one is fast twitch fiber. So what does mean by slow twitch fiber? Slow twitch fiber, which is nothing but the fibers are oxidative. Oxidative means, if you know about the biochemistry, where the ATP will be like produced by aerobic cycle and anaerobic cycle. Right. So slow twitch fiber are aerobic cycle where it will use oxygen. So that is why it is called as oxidative, where the fibers will get its OTP from the oxidative cycle. The next one which we have is the fibers will be red in color because it has the high content of myoglobin in it. Because it has the high content of myoglobin in it. And this fibers can something called as have a slow contraction time and well suited for prolonged and low intensity work. Very simple, guys. Slow twitch fibers are red in color because it has a oxidative ATP cycle production, and this muscle can able to do any activity slowly for a longer duration. This muscle can able to do any activity slowly for a longer duration, okay, without any fatigue. When it comes to fast twitch fiber, exactly opposite, where it can able to do powerful movement, but only for a few seconds, not few minutes. Ma'am, what is the example, ma'am? If you see marathon or jogging in the say, people will do it for minutes, hours, right? But when it comes to sprinting, it's 100 meter, 500 meter, right? What is the difference? So the same muscles, same body, then what is the difference? So when you make the muscle contracting, if it is contracting slowly, it can able to do a contraction for a longer duration. That is slow twitch fiber. Fast twitch fiber means sprinting. 100 meters they sprint and they'll pant. Like this they pant. Right? So which is fast twitch fibers, where it can able to produce enormous amount of force production, but it will get fatigue quickly. Ma'am, that means do our body have slow twitch or do our body have fast twitch? Actually, our body have both the fibers. Muscle to muscle, the component will vary. 50% of slow twitch, 50% of fast twitch, 60% of slow twitch, 40% of fast twitch. It will be like that. But we can accelerate this process by something called as training. For example, if I train for marathon for a couple of months, I'll do a marathon. If I train for a sprinting, I can do sprinting. So when you do the activity, then it will get accelerated. Okay. So this is the two form of muscle fiber type, slow twitch fiber and fast twitch fiber. In fast twitch fiber, there is another category which is called as intermediate fiber. So intermediate fiber means it can act like slow twitch, it can act like fast twitch. Let me explain one more time. Broad classification is two, slow twitch and fast twitch. But in fast twitch, we have a sub-classification which is called as intermediate. Intermediate means where it can able to act like slow twitch as well as fast twitch based on the need. For example, Virat Kohli can do marathon. At the same way, Virat Kohli can do sprinting also, right? So this intermediate fiber can help in work in any ways, like a middle child. Okay, so like for example, in even in our family, uh, he like I have two brothers. One elder brother, second another elder brother, and third I am. Okay, the middle child will have always the special treatment. I don't know. It might vary, personal preference. Okay, he have like he when we do a mistake, he'll say like they only did the mistake. When we did anything right, he will include his name along with us, saying that oh no like that. So he has some capability, and the same thing. Me and my first elder brother fight a lot, and we don't speak also when we fight, when we have that ego and all sort of thing. But he'll be someone who will talk to both of us. Okay, so the same way intermediate fibers have the ability where it can able to act as both. Depend upon the situation, it will get act. Okay, so this is called as muscle fiber types. So we discussed about muscle tissue type, muscle fiber type. Now let us move on to the next one. This is something which we discussed already. This is discussed. Give me a 1 moment, guys. I'm just okay. We came to have more than half people. Give me a moment. I can't open this. Just. Apart from that, in this muscle chapter, guys, we are going to discuss about how a muscle can act as a prime mover, and we are also going to discuss about what is agonist, antagonist, synergist, all sort of stuff. What is isometric, what is concentric contraction, and all sort of stuff. And apart from that, we are going to start straight away. The chapter will be done, and we are going to start with some our class. Next class will be on hip joint. As I said, now we are moving on to the joint. We'll do first hip, knee, ankle will be given as your work. Then we have what to say, upper limb, shoulder, okay, elbow and wrist will be given as your work, and spine, gait, posture. Okay, so as of now, everyone understood with muscle? Okay, perfect. So now we are moving on to the next category, which is the muscle actions case. So one by one we will do. So first one, what is mean by agonist? What is your opinion, guys? What is agonist? What is agonist, guys?
Which produces the movement.
Okay. Yes, pretty much same answer. Very good, Dashi. So agonist is something where it can able to create a movement. If I'm going to do by elbow flexion, biceps is the agonist. Agonist is something which is creating the movement, creating the joint movement, which is called as agonist. What is mean by antagonist? Simple. The muscle which will work exactly opposite to the agonist, we call that as antagonist. For biceps, triceps, For sternocleidomastoid, trapezius. So any muscle which can do the main activity, that is called as biceps. If any muscle which will do the opposite activity, that is called as triceps. Okay. For elbow flexion, biceps is the agonist. Triceps is the antagonist. Okay. But let's say elbow extension, that is the movement. That time, triceps is the agonist, biceps is the antagonist. Right? It will change based on the movement and movement. There is no muscle like this will be an agonist. There is no way any muscle can named as such. Based on movement to movement, it acts like an agonist, antagonist, synergist, neutralizer, and everything. Okay? So let me just move on to the next one. Yeah. So what does mean by antagonist? The muscle which will creating the opposite movement, which is basically called as the antagonist. Give me a moment, guys. Let me just share with my screen so that it will make it easier for me to do as well. I had some issues, so I couldn't share in the initial period. Now I have sorted it out, so I can share now. I hope my screen is visible for everyone now. So guys, we discussed about the fascia. So I'm really sorry. Let me just quickly tell. Sorry for that. It will come. Oh, it is happening. Let me just continue. So the next one, we have the agonist, antagonist. The third one, which we have is something called as the stabilizer and neutralizer case. I want everyone to please listen to this carefully. So what is called as stabilizer? Stabilizers are nothing but it will be acting in one segment so that a specific movement in the adjacent joint can occur. Guys. So my shoulder is a stabilizer for my elbow movements. My elbow is a stabilizer for my wrist movements. So it will not be acting in that joint, it will be acting in the proximal joint. So it can make the joint stable, so it will make the other movement to act smooth. For example, let's say my patient is having shoulder dislocation. If they are going to do wrist movements, they can do wrist movements, but the movement will not be smooth, right? The movement will not be smooth, right? So what will happen whenever we are doing elbow movement or whenever we are doing wrist movement? Shoulder needs to be stable to do the movement in an easy manner, right? So this is called a stabilizer. A stabilizer is something where it will be stabilizing in one area so that the other movement will happen clearly. Okay? Then what does mean by neutralizer or synergist case from your opinion? What does mean by neutralizer or synergist? So let me just share my screen so that you can see. So please look at it over here, guys. It is a muscle will contract to eliminate an undesired joint action of another muscle. It will be a muscle to eliminate an undesired joint action of the other muscle. What is the meaning of that? We used to read synergist as something, a muscle which is helping the agonist is what we call it as synergist usually. But what is the right definition is, it will not helping, okay? It will be opposing the another muscle so that it can able to produce the action very clearly. For example, gluteus maximus, guys. Gluteus maximus is a hip extensor as well as external rotator. It is a hip extensor as well as external rotator, right? Like lateral rotator. So whenever we are going to do hip extension or whenever we are going to activate gluteus maximus, it will do both the actions. It won't do one action. It won't do like, no, Anu only need hip extension, so I only give hip extension. It's not like that. It will do both the actions. Then how come hip external rotation is not happening? Only hip extension is happening because we have gluteus medius. Okay, the other muscle. So the gluteus medius is a abductor as well as internal rotator. So this muscle will act as a neutralizer. This internal rotator will cancel out that external rotator. Very simple concept, guys. Consider there is a muscle. Okay. Consider like a two hair. Okay. Consider like this is a muscle. If it's going to work, it will pull the head in this direction. So the other muscle will work and make sure it is also pulling so that the head will remain in the same position. This other muscle is called as neutralizer. So it will act so that it can eliminate the undesired joint action. What is not needed, it will eliminate. For example, for gluteus maximus, gluteus medius is a synergist where it will cancel out the external rotation by doing internal rotation. Okay? So for example, deltoid. We have deltoid all three fibers, anterior, middle, posterior. It can do abduction, it can do flexion, it can do extension. But how come flexion is only happening? How come extension is only happening? Right? Because the other muscle will cancel out that movement. Okay? For example, coracobrachialis. Coracobrachialis is a flexor as well as adductor. So it will cancel out the abductor activity. Okay? So this is basically called as the neutralizer case. So neutralizer is something where it will act so that the undesired joint motion of the other segment will not act. Okay? So this is called as stabilizer or neutralizer. Next, coming to the next one, which is the muscle actions case. So isometric. What does mean by isometric? Isometric is nothing but, guys, a muscle will be in the same length even though when it is contracting. Okay? So the muscle will be, iso means same. I hope you all know that definition. Iso means same, metric means length, where the muscle will be acting, but yet visibly we can't change any position or any change. That is called as isometric. What does mean by eccentric? Eccentric is nothing but where the muscle will elongate or muscle will produce a torque. The muscle will lengthen, guys, but yet it will lengthen against a fixed load. It will lengthen against a fixed load, that is called as eccentric activity. So I'll explain in a very short form. Muskar and some other people already know that because of my exercise therapy class, but for others, let me clearly help you. Isometric means we are already, the muscle will be doing that action. For example, towel roll under the knee, which is isometric for quadriceps muscle. What is the quadriceps action? Knee extension. When we do towel roll under the knee, how the knee is extended, right? We are extending our knee, then only we are keeping the towel roll. So actually, we are actually contracting the muscle. We are contracting the muscle and we are contracting to a stage where we are pushing it so that it don't contract furthermore. This is what isometric is. Iso means the muscle is not even contracting. It's not like that. The muscle is contracting. For example, if I'm going to push with my elbow the wall, it is an isometric action for my deltoid. If I'm going to push the wall, it is an extensor isometric activity. So I'm already doing extension if you see. I'm doing extension now. After I'm doing an extension, I can't do furthermore extension because I'm pushing a wall, which is not, I'm not a Hulk or someone who can do anything, right? So this is called as isometric. Isometric means the muscle will act. The muscle, there will be a tension, but there is no room for contraction to happen. That is called as isometric. Eccentric. Eccentric means where the muscle will elongate, lengthen with the tension. For example, let's say I have a weight like this. Okay. If I'm going to do elbow extension, my biceps is lengthening, right? But it is not freely lengthening. It is lengthening by holding a weight. It is lengthening under a tension because if I'm going to do it, the weight will fall off. Right. So it will be a controlled lengthening. That controlled lengthening against a load is called as eccentric. Okay. Concentric is something which is a normal muscle contraction base. So concentric is something which is nothing but a normal actin and myosin bind is happening now. That is basically called as the concentric. Okay. So isometric means where we were discussing about the muscle will be in the same length, yet it is acting. That is called as isometric. And we discussed about concentric and we discussed about eccentric. Are we clear in that so far, everyone? Any doubts do anyone have in this concept? I hope not. I'm just hoping this time my screen should be visible. Thank you. Thank God. So, guys, let me just quickly recap now. I can't share this thing for a longest time because of some issues, but now I can share. So, I'll just quickly go through everything with the my notes. So, now we'll release the acetylcholine, which is a neurotransmitter, which will enter into the muscle case. Okay, where it will reach the sarcoplasmic layer, where usually the calcium will be stored. Okay, because of the acetylcholine, calcium will be triggered and move to the sarcomere layer, where it will bind to the actin, which will create the contraction of the muscle, which we discussed. Which is what we discussed whenever the calcium is binding with the actin. Then we discussed about the structure of muscle. Then muscle architecture. Parallel means the muscle fibers running parallelly. Pinnate means where it is running diagonally. Okay? And parallel have 5 types. First one, flat. Flat is nothing but which is a thin, broad muscle originating from aponeurosis. Rectus abdominis, all these things. Then we have fusiform, where the muscle will have a belly and end as a tendon. Strap, uniform diameter. Convergent and radiate, it's a combination of flat and fusiform. Circular means where the origin and insertion close to each other. And we have 3 types of pinnate: unipinnate, bipinnate, multipinnate. Then we have muscle fiber type. First one, slow twitch, oxidative in cycle, red in color because of increased myoglobin, slow contraction and suited for prolonged activity. Type 2 have 2 variations. The first one is fast twitch type 1. It is a glycolytic cycle, that means anaerobic cycle, white color, rapid force production and then fatigue quickly. Okay. Then we have the intermediate, which can able to act like both. Then we have iso. Iso means same. Metric means length, where the muscle will be actively working, yet there will be no visible change in length. Then we have isotonic, where we have concentric and where we have eccentric. Then we have the agonist, muscle creating the movement. Antagonist, muscle producing the opposite movement. Stabilizer as well as synergist. Clear? Everyone for this so far? Perfect. Now coming to a topic which is called as insufficiency, guys. So before that insufficiency, I'll show the notes from the first, guys. Please take the screenshot so that you guys can do the work after the class. From here, let me count of 3 to 1. So 3, 2, 1. I hope you all done. This you have written already, so wait a minute. Okay. 3, 2, 1. Three, 2, 1. So again, wait a minute, guys. Let me just zoom out a bit. 3, 2, 1. Wait a minute. Yeah, please go for it. 3, 2, 1. Again, 3, 2, 1. Three, 2, 1. Then 3, 2, 1. 3, 2, 1. Okay, guys, thank you. Let me explain now. So, what does mean by insufficiency? So, sufficiency is something in any muscle crossing only one joint, guys. It can able to work beautifully in that joint alone. If any muscle is crossing two joints, it can able to do beautifully well individually to each joint, but not at the same time. For example, you can listen to the class in a good manner. You can write in a good manner. But if you're going to do at the same time, it is a little bit stressful, right? Okay, so you are sufficient to do one activity, but you are insufficient to do two activities at the same time. This will also happen to muscle. There are muscles which is crossing only one joint. There are muscles which is crossing multiple joints. If there are muscles which is, for example, biceps will cross shoulder as well as elbow. It will act beautifully in shoulder and it will act beautifully in elbow. Okay, but if it's gonna work simultaneously in the two places, it will go for a phase which is called as insufficiency. So for example, I want everyone to take your wrist, okay, do it like in a casual manner, okay, no contraction, okay, just normal free hold, and I want you to go for wrist flexion normally, flexing your wrist. If you look at your fingers, it is automatically in a slight extended position. Now, I want you to don't change your wrist position. Your wrist should be in the same position. Now, without changing your wrist position slightly also, I want you to try to make a fist of your fingers. Can you feel you're having a discomfort? But same way, don't release your fingers. Slightly extend your wrist. Was it easy? This is called as insufficiency, where the wrist flexors and finger flexors are same muscle, not different muscle. So it is already acted in one joint, like wrist flexion. So it is having an insufficiency to do the finger flexion. Okay, this is called as insufficiency. The same way can happen to wrist extension also. I want everyone to make your wrist neutral again. Go for wrist extension. If you see slightly, your fingers will be flexed. Slightly. It might vary also. Now, I don't change your wrist position. Okay, wrist should be in the same. Now, try to extend your fingers. Can you feel a discomfort along your thumb and all? The same way, the wrist extensor is also same category. This is called as insufficiency. Okay, so if this insufficiency happening during contraction, that is called as active insufficiency. For example, when we do this is contracting already over here. It is unable to contract over here. This is called as active insufficiency. Passive insufficiency means like this. It is already stretched over here. It is unable to stretch furthermore in the fingers. So during contraction, if it is happening, that is called as active insufficiency. During elongation, if it is happening, that is called as passive insufficiency. Ma'am, what is the purpose of me knowing this? Because our patients will usually come and ask these kind of questions that I am unable. I had a patient who had a scaphoid fracture. And he was saying like, I can't fix like this. I have to tell him, dude, no one can't fix like this. Right? So when you don't know that muscle efficiency, you will say an answer, it will come eventually. Even after years also, it never come eventually. Because it is an insufficient phase. So you have to understand where it is sufficient, where it is insufficient. For example, I want everyone to flex your elbow. Now try to do 180-degree shoulder flexion. Don't do abduction. Shoulder flexion. Try. Uncomfortable, right? Little bit. Again, insufficiency. People will come. I can't like scratch my back. I have to say, dude, first flex, then scratch. It will be easy. They'll go like this only in the initial stage itself. It is an insufficient for everyone. So you have to understand this nuances of muscle, how it is happening. Are we clear in this? Everyone? Yeah? Perfect. So let me stop it over here.